welcome to our webinar, Digital Healthcare, Regulatory Outlook and Key Events in 2017. I'm happy to moderate this webinar today. I'm really happy that we have more than 160 people that have registered for that webinar. It's actually the first time that we have audience from all of the continents around the globe. We have listeners from the US, from Europe, from the Nordics, from the Baltic countries, from Egypt, from Japan, from New Zealand, from China, Indonesia, Brazil. So welcome to you, everybody. We're really happy to have you here. For all of you who have listened to our webinars before and miss Omar today, he cannot be with us today, but I will just jump in and do the moderation for him today. So please excuse if there will be any hiccups. This is my first time doing that, so yeah, sorry in advance. But let's get started with a few introductory words. I will start with telling you something about Germany Trade and Invest and what we do, in case you have not heard of us before. Germany Trade and Invest is the economic development agency of Germany. In a nutshell, we help international companies establish business operations in Germany. These are our four main tasks. We market Germany internationally as a business and technology location. We also promote the new federal states, so the former eastern states of Germany. We also provide export information for the German economy, and we provide business location consultancy services. These services look like this. They include market and industry reports. We also provide market entry analysis. We can also help you with tax and legal information and also funding and financing information. We also help you finding partners in Germany, and we help you to select the right location within Germany. All our services, as well as our publications, are free of charge, as we are funded by the German government. Our series about German healthcare is already a few years old. We started the series in 2013. Here you see some former webinars. We covered topics such as medtech, also regulatory update. We covered biotech, but also mobile health solutions. Our next webinar in July will be about in vitro diagnostics, and in October we will cover medtech again. So let's start with this current webinar. This is how our agenda will look like for the next minutes. We will start with Sebastian Zilch from the German Association of Health IT Vendors. He is responsible for governmental affairs and strategic networking. My name is Julia Rühle. I'm the manager for healthcare at Germany Trade and Invest. We are both based here in Berlin. At the end of the webinar, as always, we will have time for question and answers. Feel free to use the chat feature on the right. You will not interrupt us while we speak, so just go ahead and post your question whenever you like. So this to my introduction, and now I will hand over to Sebastian. Sebastian, you can now take over the rights, show your screen, and begin your presentation.
Well, thank you, Julia, and welcome everybody. Also from myself, Julia already mentioned, I'm responsible for governmental affairs and strategic networking. This includes being in touch with the international community, and I will today talk a little bit about who we are in the first place and what we also do in the German market, about an event we host, and we'll then go into legislation in terms of German legislation, and also about some specificities specifics about the German market. Touch also a little bit upon European regulation for all of you who are not familiar with this, and then provide an outlook on what eHealth or digital health in Germany will look like in the next couple of years. So first of all, who are we? The German Association of Healthcare IT Vendors consists of 63 leading companies in the German market. You can see all the logos there. Maybe some of you will recognize your own logo perhaps, or also some other global players who are part of our association. What we do is that we represent the company's interests in the market towards the government, but also other associations. This is possible because we have a large market coverage. It's about 90% of the German health IT market being member to us. So we are also a very good networking platform. A lot of our companies also work internationally. So this is also why we see that, for example, European integration, but also more than that, is a very important feature for, especially for digital topics. We want to establish healthcare IT in all areas of medical care, and therefore we need to be in close dialogue with the government agencies, and also make sure that market competitiveness is stable. You probably know that the healthcare market most of the time is a very regulated market, so we want to make sure that our members actually have a chance to have the best market environment possible out there. So what else do? We are host of conhIT, Connecting Healthcare IT, which is the central platform for healthcare IT in Germany. It's actually the largest event of its kind in all of Europe. And it's built upon 4 pillars. There is the Academy, which helps people to acquire new knowledge on healthcare IT. We have the Congress, which discusses like several important topics, mostly relevant topics for the German market, but we'll also have international sessions. I think Julia will touch upon that later as well. Then we have the networking part. This is a very essential element of our business and our activities altogether. Various formats, various topics we cover there. I'll talk about this in a minute. And there obviously is also the industry fair, which is very important for us. Our members also get discounts there at the CONHEAD Industry Fair. Just to give you a few numbers on this, you can see that healthcare IT in Germany gains in relevance. When you look 2008, when we started CONHEAD, there were only 144 exhibitors. 2016, there were already 451. And you can also see that we get a lot of international exhibitors. So this can give you an idea of how healthcare IT is in transformation and also gains momentum in the German market. Now on the CONHEAD highlights for this year, just to give you a general idea what that looks like. We'll have a strong focus on the new world meeting the old economy, kind of. So startups meet established players. We have several formats for that. We have a dedicated eHealth zone where all the mobile health applications have a chance to exhibit. We also focus on connected health. We have a large focus on interoperability, as this remains an issue within Germany, but also beyond. There is a focus on cybersecurity, and also for us personally, it's a very important date because it's the 10-year celebration. Just someone's not on mute. I don't know if it's only me who can hear that. Yes, and also we are very, very proud that CONHEAD is recognized politically as the Minister of Health, as the patron of the event. So what does that mean, the health minister being the patron of CONHEAD and also caring for healthcare IT? There's very obvious reasons, because the government has engaged in healthcare IT topics in the last couple of years extensively. I just want to give two highlights here, which will influence how the eHealth environment will develop in the next couple of months and years to come. There's the IT Security Act, which was passed 2014. For those of you who know the European legislation, it's similar to the NIS directive. So there are increased coordination and reporting requirements. We are currently in the process of defining what critical infrastructures are in the healthcare sector, and one can already tell it's not passed yet, so it's still being debated, but mostly hospitals will be critical infrastructures, and especially hospitals who handle 30,000 cases per year. What does that mean? That means that these hospitals will actually have to upgrade their existing health IT infrastructure to also adapt to the requirements from IT security. And this is a major deal since funding for German hospitals on healthcare IT is not the highest, to be honest. And this is something that will have to change in order for this law to actually have a proper effect. Currently, our association is involved in defining the security standard for the healthcare sector and to allow all the hospitals to actually comply with what they are asked to do. Another very important health or a legislative act was the eHealth Act in 2015. It focused on the telematics infrastructure and attached services. I'll talk about that on the next slide. They also introduced an interoperability registry. The idea is that having a register where all the standards and are listed and actually are compulsory for usage, that this means that interoperability increases. The registry is not open yet. We expect that to happen by June, and we'll see what effects this will actually have on the German landscape. One thing's for sure, they intend to have to rely heavily on international standards to become compulsory in the German market, which is not the case right now, especially in ambulatory care, a little more in terms of imaging and also in terms of the hospital setting. Still, then what we personally think as an association is a very vital thing here is the introduction of electronic patient records in the year 2018. We see that as a very prominent vehicle for digitization of healthcare, and we are currently in the process of defining what that means, how reimbursement is going to look like, how compulsory this would be for physicians to use, and how this can be connected with the telematics infrastructure. I've mentioned this infrastructure twice now, so let's have a brief look at what that actually is. The idea of the telematics infrastructure is to have very safe communication with the two key principles. So data is exchanged between professional users only if a physician and the patient insert the key and therefore agree that information can flow. The idea is to build a network within the healthcare so information can be exchanged safely. There's a very high security standard, very high data protection standard, and so that it took Germany a couple of years for this to be rolled out. So the process started 10 years ago. It was a very complex negotiation situation between all actors involved, and the test rollout of this system has started last year. in the third quarter, and the federal rollout of the system intended to start this year, so fall this year, running in the beginning of 2018. So this is thought of as the major communication platform and enabler of digitization of healthcare in Germany, especially by the legislative bodies. So this is a very important large-scale project. If you need information on that, I added the website here, the Gematik, as you say. This is the agency responsible for the rollout. So now, a very, very brief input on European regulation, which is relevant also on the German market. For one, there's the General Data Protection Regulation, with all the new requirements being applicable in May 2018. All of you probably know that Germany is very much focusing on data security and data protection, so we're going to be the first country actually adapting it to national law. Another regulation which will have big effect on software in healthcare is the medical device regulation, which in Article 11 states that the classification as a medical device is most likely going to shift. You see there, it's going to be an upward shift from very low classification to high risk, with all the compulsory obligations that come with that. Now, a very brief outlook here is that it's actually a rather positive outlook. So we had this webinar 2 years ago, and I could talk a lot about the challenges. I still can, and I guess all of you can talk about the challenges in your country. But there have been a lot of very positive trends. For example, the government set up the Federal Health Fund for Innovation, which focuses heavily on digital solutions. There's also a website there if you need more information on that. We'll see if the General Data Protection Regulation will actually help with data protection disharmony, I'd call it here, because we have all the federal, like the federal structure actually makes data protection a challenge a lot. And we expect that this is going to be alleviated with this. And also what's clear is that after the elections this fall, the next government, federal government, will work on an eHealth Act 2.0. We don't know what's going to be in it. Honestly, there's just some points here which have been talked about or we could expect, which are also very positive trends. So let me end with saying that whatever the details for further developments in terms of eHealth in Germany, the environment has changed. It's a much more positive outlook, and Germany is finally in motion also in terms of digitizing healthcare. So thank you very much, and feel free to get in touch about the environment, legislation, or even if you're interested in bvitg and what we do as an association. And yeah, feel free to meet at CONhIT.
Thank you very much, Sebastian. That was really a great overview, great outlook. So I will get back to my presentation. I hope you can see my screen again. And now I will start with my presentation. Yeah, I will focus now on some key events in Europe and, of course, how to make best use of them. Don't worry, this is not going to be a lecture about how to prepare for a trade show in general, because I know the most of you have been to trade shows before, frequently go to them and also exhibit. Today we want to focus a little bit more on how to use trade shows for entering the German market. Of course, you know that trade shows are a really great tool to understand the market, not only the the country where the trade show is in, but also other markets, because trade shows are usually meeting place for many countries around the globe. Really international audience. It's also great for networking, of course. You want to meet with your partners there, but you also want to find new partners. And of course, you will find your customers there. You will learn about new sales channels, make use of them, and create more brand awareness. So let's look at some of the key digital health events in Europe for this year. I will start with Battelle. This one is just 1 month away. It is taking place in Luxembourg. It is an event of the International Society for Telemedicine and eHealth, but it does not only focus on telemedicine, but also on digital health or eHealth in general. Also focuses on mobile health, for example. And it's actually a meeting place for international association that focus on telemedicine. Another one that is taking place in May after the conhIT, which I will focus on later, is the eHealth Week. The eHealth Week is organized by HIMSS, and this year by the Maltese Ministry of Health as a part of their presidency of the Council of the European Union. Last year it took place in Amsterdam and the year before in Riga, so it's really great to get around in Europe and also see great cities. You see from the numbers that it's more conference, but also has exhibitors and also has a matchmaking tool, which is really a great tool to arrange meetings in a really efficient way. Because if you register for this show, you can also register for free for this matchmaking tool, and you can then arrange meetings by uploading your profile and get in touch with your new partners or customers. So this is really good show. Also a little bit more focused on a specific field, the cardiovascular field, is the e-cardiology and eHealth in Berlin, taking place in November. It is also a little bit smaller. It's more a conference than an exhibition, but if you focus on this specific field, this might be a really interesting show for you. In November, of course, also taking place the Medica. I guess you all know it. If you're in the healthcare scene, it's the world's largest event for the medical sector. You will find everything there, from medical aids, medical equipment, the traditional medtech, but also innovation, and also forums about digital health, health IT, connected health, an app competition. Medica has 17 halls, more than 120,000 attendees, nearly 6,000 exhibitors. So for those of you who have been there know that it's really a big show, and you really have to prepare well to make the most of it, but also survive Medica, so to say. Another one in November, if you have enough from the rainy and cold weather in Germany, go to Barcelona to the World of Health IT. This one is also organized by HIMSS. It actually consists of 6 summits, including the CIO Summit and the mHealth Summit. It also features the Cybersecurity Summit, the Genomics Summit, the HIMSS European communities meet there. So it's something there for everybody who is interested in specific fields in health IT. And of course, finally, I will now focus a little bit more on conhIT, which is just around the corner. We are right in the middle of planning our appearance there. Sebastian has already gave you some of the facts about conhIT. conhIT is actually the largest and leading event in health IT in Europe. You see here by the numbers, nearly 9,000 attendees, more than 500 exhibitors. This number is constantly rising, and CONHIT is also getting more and more international. And we as Germany Trade and Invest are happy to be part of this. We actually we will be active in 3 different parts. I will elaborate on this in a second. If you want to make the most of CONHIT, I can just recognize if you from you know, different countries, no matter from what country you are, just inform yourself if there is an international delegation. This is really a great tool to not only visit the trade show, but also get more information as the organizers of these delegations always have a program around CONHIT. Also, for example, tours to hospitals or other programs around it. If you have not registered yet, and if you have not found if your country has an international delegation, please don't hesitate to contact us. We are in great contact with the respective countries, and we are happy to directly connect you to them. I'm sure that some of them are also listening today, so feel free to ask us and we will connect you. Another good tool, of course, are the country pavilions, especially if you would like to have just small space but still want to have a great appearance and be part of a bigger booth, for example. And of course, last but not least, the networking receptions, never to under-evaluate, because sometimes you meet the right people at the end of the day when you're not really, if you're not really aware of it. So these 3 parts, something that you should really could take advantage of. So as I said, we will be part of CONHIT in 3 ways. First of all, we will host the International Networking Lounge again. This is a picture of last year. This year we will have more space. We will have a bigger booth and more room for audience. So we're really happy to welcome you at our booth. Meet me and my colleagues there. We are in Hall 4.2. Our booth is 111. And I have talked about all of our services in the introduction, and I can tell you that we had companies coming to us just wanting to know general information about the German market. We also had companies that came to us because they already know that Germany is the right market for them, and they now need help with registering their company in Germany. So we're happy to discuss all of this at our booth. The second part, also the international session at the conference program. Here also a picture of last year's session. This year we will focus on global perspectives on health information exchange. We will host this session together with the European Association of Hospital Managers, and we will have examples from Ireland, the US, Italy, Germany, and Switzerland. This is going to take place in Hall C on April 26th. And of course, our networking session at our booth at the International Networking Reception in Hall 4.2 again. This is a picture of last year, and now you understand why we need more room for audience. This picture was taken during our country presentation. We're really happy to welcome you during our session. If you have registered for CONHIT, you can just come by. You will find the program online, and we will also have it at our booth during the fair. Our program this year will look like this. We will start on Tuesday with the international market opportunities for digital health companies. All our sessions, we will organize all our sessions together with our trade colleagues, so our colleagues that are responsible for trade information for German companies that wish to go abroad, and with our health initiative, Health Made in Germany. So in the first session, colleagues that are located in other countries around the world will come to conhIT and provide information about the market they are responsible for. They will have a small introduction, but they will also be available at the booth. So if you're interested in a market abroad, we will also have the market information available at the booth. So far we have positive answers from our colleagues from the Baltic countries and also from Canada, but we are still in the middle of preparing our program, so there are more to come. Then on Wednesday we will have our country presentations again, market insights by international partners. For those of you who have been at our booth last year, this year again we will have presentations by our partners, other economic development agencies that will give presentations in just like pitches, really short, really focused on what their countries have to offer concerning health IT, digital health, and so on. And then finally on Thursday, how to access the German market. We will present best practices in digital health. So we will focus on the German market again. We are really happy to have Patientus at our booth. They have developed an online consultation platform that is a German company, and then we also have My Sugar, and diabetes management app from Austria. They are also active in Germany, and they will both share their experience in Germany, also talk about the hurdles, but also about how they have become successful in Germany. So you see there's a lot going on this year again, of course. We are happy to meet you at conhIT, as I said before. We are also happy to meet you at all the other events throughout Europe. If you are in Germany, come by our office. We're right in the center of Berlin. And now we have time for questions and answers. So keep posting questions in the chat feature, and I will just start to read them out as they come in. So the first question is really easy to answer. The first question is, will the presentations be available after the webinar? Yes, indeed. The presentations and the link to the presentations will be sent to you after the webinar. Give us a few hours to set everything up, but within a few hours you will be able to have the webinar again and also the presentations. Okay, then I have a question concerning the security standards. Sebastian, I think that you have talked about this before, but maybe you can rely on this again. I will read out the question. Is there a draft or something that is already public about the security standard for healthcare?
Well, thanks, Julia. In fact, they are currently in the process of working on a draft to set out what critical infrastructures are. So the actual eHealth Act has been passed 2014. Now they successively work on the different sectors. Healthcare is currently being drafted. So there are some numbers in there which they think should be covered, or which should qualify for critical infrastructures. This, however, is not what I was talking about earlier with these the security standard for healthcare. This is still to be developed. There is a body working on this, which consists mostly of hospitals who fall under this definition of critical infrastructures. So there's a lot of motion in there, and we as association are working on this. So we're currently trying to draft something like the standard of IT security in Germany. This process, I don't know, it's hard to say how long this will take, but we hope to have first results by summer this year, so as soon as possible, because otherwise the default is a very, very complex security requirement by the BSI, which is our institute for IT security in Germany, but for everything, not just healthcare. And they've decided that the different sectors should, as they know their requirements best, work on this piece of regulation. So the answer would be no, we don't have the IT security standard for healthcare yet. We're currently working on this together with the hospitals and are still in the process there.
Okay, we have also questions concerning conhIT. Here's one question about the conference language. Sebastian, correct me if I'm wrong. The international networking lounge, of course, our program will be in English. The conference sessions will be translated, right? So they will be in German, exactly. Some of them, but then they will be translated.
Exactly. So as I explained, there are several pillars, and everything that happens in the Congress session, there's simultaneous translation to English, respectively the other way around, because one session is actually in English. Julia also touched on that before. One has to say, yes, we are trending and becoming more international. Still, the German market is dominant there. So if you're interested in the German market, this is very perfect. I think we're slowly coming to a level where CONHIT is actually a marketplace for all all countries. So our vision would be that maybe in a couple of years, Irish healthcare providers sell to the Spanish, for example. We're on our way, but yes, so the main language spoken is German.
And another one, are there discounts for startups or something like pitching competitions? Do you know about the discounts, Sebastian?
Well, we don't have, as far as I know, there are no discounts for startups. However, I know there's a pitching session like on CONHIT. I think this is a very specific question which I can't fully answer right now. There's several competitions around. I know the Dutch government is hosting a startup pitch. It's also in the international program. I think they are open for applications. This happens outside of CONHIT, so independent of rebates for tickets, this is possible. Apart from that, if you're just up for a tease of CONHIT, you can buy a one-day ticket, and I think the prices are fair. It's 55 euros a day, and I think 130 for 3 days. So I think this is also really startup friendly, all in all. So we don't really have special discounts on that. We have special discounts for exhibitors, for sure, but not necessarily for startups.
Here is a typical question concerning where innovation is lacking in digital health. So which sector is most lacking in digital health innovation? Sebastian, do you have an answer right away?
That's the whole question for panel discussion.
Yeah, that is true. That is true. But it's really
big one.
Yeah, it's really typical.
I'd
It's actually a good question. Yeah. Go ahead. Sorry.
I'd say that in general, the way how healthcare works in Germany is that in the hospital setting, there's much more flexibility for innovation. So the way they can spend their budget is that they have a budget, they can spend it however they want. And if they think that something will help them to make their processes more efficient, they can just do it. So obviously, this is where a lot of innovation happens. The ambulatory setting, especially in the statutory health care system, that's a trickier one, honestly, because there you have a catalog of services which are being reimbursed. If your service is not in the catalog, then you don't get money, which means that the physicians are less likely to actually offer it, because the patient, it's probably like this in other countries as well, but especially in Germany, is reluctant to pay out of pocket for services in healthcare. So there are some partnership agreements if you want to get into this market. If you work with the statutory health insurance funds or even with the private health insurance funds, you can enter the market. But to be able to access the whole market, this is a little more tricky, and hence we argue that innovation is a little less there. I've mentioned earlier this innovation health fund. So this has the intention to break this, or like to shake this up a little. So we'll see what happens. It's only been in place for a year. There's going to be another 3 years for this money. It's 300 million a year being spent on innovation, and there's a lot of digital projects. So, but I guess this is the general picture on this question. When you go into different different aspects of the healthcare chain, for example, I'd say that especially in care science and home care, we're very far behind. There's a lot of potential there, which is not on the agenda yet. I expect that to change next year as well, because there's going to be a study by the ministry on that, digitizing healthcare or like care services, and we'll see what happens. Honestly, I don't really know what's going to happen, but this is something that's very slow. I mean, this is not a full picture of an answer, but I hope it points into the right direction. If not, feel free to ask again.
Okay, then we have another question that is frequently coming up about the willingness of psychologists and patients using here in a specific field e-mental health. So I can start on this, and Sebastian, if you have something to add, please do so. I think that in general the question about the willingness of patients in Germany is really clearly to be answered. We have, of course, patients that are really open to use digital health in whatever field, if it's in the hospital or at home as customers, for example, health customers. So there's no doubt about it. Of course, we have this this awareness, as Sebastian has said before, about data protection. Of course, it's also a generation question, right? People that frequently use IT in their daily routine will be more than happy to also introduce that or use that during procedures or during managing their disease. And regarding e-mental health, of course, I know of some really active companies that have focused on this specific field. For example, mobile health companies that develop apps in Germany. I see that a lot coming up, and also of course clinicians that focus on this field, because as you know, mental diseases or mental challenges are really a good field to use digital products, digital services, because you have to you have to manage so much, right? You have to write diaries, for example, for some of the diseases, and of course it makes a lot of sense to do that electronically. So to sum up, we see great willingness from both clinicians and patients in that field. Okay, so feel free to post more questions if there's
Julia,
anything.
I think.
Sorry, yeah.
I think there was another question that I received was regarding the 203 German Criminal Code, and
Okay.
so just to put that in perspective, there was a situation that it's actually illegal to do remote maintenance work because the physicians were not allowed to share their knowledge on a patient with a service provider. So, however, in terms of digital age, sometimes it's necessary that the service provider needs to access these health information, and that has been, well, not perfectly legal, not very illegal, because nobody really complained about it because people knew this is something that needs to be done. Actually, the government has acknowledged this, and we are currently in the process of working this paragraph over. So we expect a change, an adaptation of paragraph 203 of the German Criminal Code before, probably even before summer. So it's in the process, and this will actually make it much easier and much clearer what is allowed and what is not allowed. So this has been a topic that we as an association have pushed as well, and seems like successfully. Julia, you still there?
Sorry, that was good. I just had the mute button on. I said that just go ahead and post more questions if we have not answered your question yet. We will answer all the questions that we have not touched upon yet in the follow-up. So don't worry, your question will not disappear. Sometimes they are just a little tricky, and we want to make sure that we give you the right answer right away. Sebastian, did any question reach you in the meantime? Is there anything that you wanted to answer?
There was one on the medical device regulation asking if I was referring to Annex 8, Section 6.3, Rule 11, and that is the case.
Okay. Okay, so if you're happy with us today and you have no more questions, I will close this webinar today. Thank you very much for your attention. Thank you, Sebastian, for your presentation and all the answering of the question. Thanks to Katrin, my technical support here in my office. Thanks to you, everybody, for your attention. As I said, you will have the presentations and answers to your questions that they have not been answered yet later on. And I will close the webinar today. Have a wonderful day, and see you soon. Thank you.